I had to wear my Navy uniform for our next presentation. Our next recipient can't be with us on stage because he is a reservist recalled to active duty and currently serving our country in the Middle East. Representative Cary Pigman is a residency-trained, board-certified emergency medicine physician practicing at Florida Hospital Heartland Medical Center in Sebring. You may remember Dr. Pigman from attending our Politics in the Park last year during our conference. Cary began his medical career as a doctor in the U.S. Navy, attached to infantry units in the 2nd Marine Division. He left active duty in 1989 and remained on an active reserve duty as a commander until 2000. During the Iraqi surge in 2009, he left the Navy and went into active reserve status in the U.S. Army. Wait a second. He left the Navy and joined the Army. Emmett, he left the Navy and joined the Army.
Still got to give him the award.
No, we didn't know this when we were giving him the award. We can't give him this award.
Now, Senior Chief, go Army, beat Navy.
Well, anyway, Colonel Pigman, he outranks me, so let me continue on with this. In 2001, Cary was commissioned Lieutenant Colonel in the U.S. Army Reserve. He completed a 6-month deployment in northern Iraq, serving as emergency medicine physician at Forward Operating Base Diamondback in Mosul and Contingency Operating Site Warrior in Kirkuk. I can tell you from personal experience, you will not find a Western diplomat at any of those locales. Dr. Cary Pigman was elected in 2012 to the Florida House of Representatives for Highlands, Glades, and Okeechobee counties. During his freshman year, he worked with us on an amendment to prohibit trial lawyers and their paid surrogates from serving as ombudsman. He was also supportive of litigation reform for nursing homes and proper funding for the care of residents, and for these actions, he is a champion of the elderly. So, Representative, before we present you with this award, please tell us about your deployment and how you are serving your country in Kuwait.
It is hot and dusty here. Every day it gets to be about mid-120 degrees. And about all I can compare that to is imagine someone standing in front of you blowing a hairdryer at your face on high, and then someone else is sprinkling sand in that air. That's what it feels like to be here. I'm the Chief of Emergency Services at the 48th Combat Support Hospital in Camp Arif John, Kuwait. There are 3 of us doctors who cover the ER, so we do 12 hours on, 24 hours off. You know, it's a lot like a civilian emergency department. We have a younger patient population. In fact, at age 54, I'm probably among the elderly here. Sports injuries are one of the most common things we take care of, and you take a soldier and you give him a sport, no sport is safe. Even volleyball becomes a full contact sport. I'm here for 90 days. If you go back 10 years ago, the average physician who was recalled to active duty, and I think about 70% of us docs are reservists in the military, they were gone for a year. And when they got back, they found that their practices were gone, and they looked for all kinds of reasons to get out of the reserves as quickly as they can. So they created this 90-day boots-on-ground deployment for us doctors. So I'm a 90-day bogger. I'm getting towards the end of it. Pretty soon I'm going to be demobilizing and refratted, or released from active duty, at Fort Bliss. I look forward to getting back to good old peaceful Tallahassee and getting back to work. Anyone in the audience who's ever been deployed knows that as you get towards the end of a deployment, every soldier starts thinking about the same things. Number one, being able to get up in the morning and have to figure out what to wear, that's a wonderful thing. Thinking about home-cooked food instead of chow, or even going out to a restaurant as opposed to going to a chow hall. Or something as simple as being able to go to the bathroom instead of this place called the latrine, and then not having to share that bathroom with 30 of your same-sex co-workers. Those are the kinds of things I look forward to. But I tell you what, military folks are great. It's an unimaginable sense of fellowship and belonging to be here. It's very rewarding. I find it incredibly rewarding. And for me, since I'm healthy and can do it, I can't imagine wanting to do anything else than to at least serve these young people for at least some time.
Well, Dr. Pigman, that sounds like a great way to spend your summer. Please tell us what it was like being a doctor in the legislature and a freshman legislator.
First off, all my fellow legislators are interesting people, they're captivating people, they're intelligent, they're really wonderful to be around. And Speaker Weatherford has been remarkably inclusive and provided wonderful leadership. During the campaign, and this was reaffirmed during my freshman year, I realized that almost all issues are just as complex as medicine is. So what I try to do is to bring that same level of consideration and concern and attention that I would to a complex medical problem to all the issues that come before the legislature. Now, there is this dynamic tension, and I'm still trying to come to grips with this. I'm trying to understand it. There's a lot of very reasonable people who expect straightforward and relatively simple positions. But if the issue under consideration is complex, very often that position needs to be equally complex. So I'm still trying to understand how you responsibly answer to your constituents and be honest to the underlying complexity of the issue. I see that as a real challenge. Healthcare is important. I'm a conservative Republican. I want to see our tax dollars achieve the greatest value. We all abhor waste. And I believe that there must be some fundamental changes in how we finance healthcare and how we deliver healthcare, or we won't be able to afford it in the future. But my solutions would retain the private free market, where profit is a good thing, would retain competition, which ensures quality, and focus on healthcare provider teams, and be driven by data-driven pathways that are associated with better outcomes. That way we get value. We need to make sure that as much as we can, all the incentives of all the players are properly aligned. What that means is that the legislature should be assisting you all to be the best, most efficient, and most profitable systems that you can.
Well, Dr. Pigman, we all thank you for your service to your country and for your support of long-term care providers and residents during the legislative session. And thus, on behalf of Florida Association, we are proud to name you a champion of the elderly.
I sincerely thank the Florida Healthcare Association for honoring me by selecting me for the Champion of the Elderly Award. We've all heard that quotation, that a society is judged by how well it cares for its weakest. I believe that. And it's not only how well we care for them today, but also what we do to ensure that we have the capacity to care for them tomorrow, next year, and then the next decade. Wasting resources today could destroy that ability to provide that care in the future. I see you all as being focused on being there in the future, providing valuable and compassionate care to those weakest who are disabled and debilitated. So I look forward to working with you all to ensure that ongoing capacity. Thank you so very much.
Thank you, Dr. Pigman. Let's give him a standing round of applause, please.